Well, good morning. It's Monday. I guess actually it's officially it's noon. Welcome to Get Real with Rick Dancer, sponsored by CrisDental, our new client. He's a dentist here in town, has an amazing office. And Michael called me up and said, Rick, we ought to do a show on teeth whitening because a lot of people don't understand how it works, what it is, why people do it. Should they do it? What product should they use? And so we're going to bring them on. This is Michael right there. Say hi, Michael. Michael Bratland. And Liz, introduce yourself.
Hi, everyone. My name's Liz. I work for Ultradent. We supply Dr. Bratland with most of his whitening products. So his office uses opalescence, and that's a lot of what we'll be talking about today.
So you guys, one of the things Michael wants to do with this too is he's going to offer what you have to do is go like their Facebook page, and I can't put it on here now or it ruins the signal, but you can go find them, CrisDental. It's in Eugene. Like their Facebook page. Tell them why you want the whitening kit. They're going to pick a winner, and they're going to give away 2 whitening kits, and we'll tell you a little bit later what's in those. But if you've never whitened your teeth, you're missing out. Nothing ages you more than wrinkles on your forehead than teeth. I can't do a whole lot about those, but I can do something about my teeth. And so, Michael and Liz, why don't you, first of all, I think the easy way that people look at is these whitening toothpastes. Does that really work? Does a whitening toothpaste really work? Either one of you.
Okay, I answer this. Liz might have a different opinion because they sell whitening toothpaste. So whitening toothpaste will actually remove like extrinsic staining, like debris that's on your food or on your teeth, but not so much. It doesn't bleach like bleaching trays do. Liz?
Yes, and you want to be careful with a lot of whitening toothpaste because a lot of over-the-counter whitening toothpaste are actually very abrasive. And so they can actually be more harmful to the enamel. So you really want to be careful when you're using whitening toothpaste and you're buying them just at the supermarket. I would say if you're purchasing it through your dental provider, like Dr. Bratland, you're probably getting a whitening toothpaste that's a little bit more safe because there are different mechanisms. Some whiten because they're overly abrasive, so they'll remove a layer of that enamel. But others whiten through more of like a chemical reaction where they just help remove surface stains. So like Dr. Bratland said, they're not really going to be penetrating inside of the tooth and whitening from the inside out like your bleaching products would, but it will help remove some surface stains. But you do want to be careful as far as what you're using.
Let me add this, though, is once you remove the enamel, it never grows back. So like you got to be really careful with those over-the-counter products or some of the things you see on late night television shows, because the enamel doesn't ever grow back. It's gone forever.
So these toothpaste that claim to rebuild your enamel, that's ridiculous.
Your enamel won't regrow. You can add like potassium ions into the enamel, make it stronger, but you'll never regrow your enamel.
So why do people bleach their teeth?
Well, I don't know. It didn't make them look young. You have the whitest teeth I've ever seen in my life. I got to tell you a story. He came to my office the other day, and I had it bleached for a couple of months. And the whole time he's talking to me, I'm covering up my mouth because my teeth were getting a little darker. So since you came, I've bleached probably every day.
So people do notice, and it's one of those things where it's not just surfacey. It does really, Liz, you were saying this is really a confidence thing when somebody's,
exactly.
I've had other people come up to me and go, God,
yes.
I'm younger than you. I feel really bad because my teeth are not white. And I'm going, well, and I don't do it all the time, but I bleach them probably a couple times a year. But go ahead, talk about that.
Of course. I think people whiten for a lot of different reasons, but, we're in the smile industry, and, when you whiten your teeth, it will give you, your confidence back, and that's what whitening helps you do. And that's what just going to the dentist and making sure you're getting your dental treatment will do, is it just helps you gain that confidence so that you can, have a job interview, have all these different things in your life that really represent confidence. And so, it can really change someone's smile and therefore change how they feel, which really opens up a lot of different doors for them.
So can you over bleach?
Yes, you can. I've had a couple patients, and it was when I was, by the way, when people say hi from Roseburg, hi, everybody, Roseburg, love my Roseburg patients. Love them. Best patients I've ever had. Not that I don't love my patients here, but they just.
I've had, I don't know if you saw on our live the other day, Michael, too. We had a ton of people from Roseburg coming on and going, oh,
they
yeah,
are the salt of the earth. Super nice. So I've had a couple patients when I was in Roseburg that bleached beyond like too far. And if you bleach too far, I've seen it where you get this blue tint in your tooth and you'll never go back to normal. So yes, but that's rare, like really rare.
Does it work on bridge work? Somebody wants to know. Michael Sterling wants to know.
No, unfortunately not. No fillings and crowns. That's why it's really important that you whiten your teeth before you get a crown. And if you break a tooth and you know that you want to whiten your teeth, but you don't want to walk around with a broken tooth, just ask the dentist to go with a little lighter shade on your crown. Never darker, because once your crown's set, it's set. It'll never change. Liz, it looked like you were going to say something too.
Oh, no, just to answer your question as well, Amanda. Typically, any lab work cannot be whitened. Just natural enamel can be whitened. So any bridge work, any fillings, any dentures, none of that stuff can be whitened.
Except I've never tried dentures before, and I got to tell you, some dentures' teeth are very porous. So you might get some kind of effect, but don't take my word for it. Talk to your denturist on that one.
So how does it work? I mean, how does bleach work? Because I think you've got products over the counter. You've got products that are professionally put on like you guys do. Kind of give me the hits, runs, and errors so I know what I'm doing right and wrong.
I'll let Liz. Liz is the expert.
Sure. Yeah. So like I said, it kind of depends on what you're using. You know, if you're using a whitening toothpaste, that's a little bit different. But typically, any bleach that you are using that comes in a tray will whiten through peroxide. And so peroxide is a gel, and what it does is it penetrates into the teeth. And it breaks down into water, oxygen, and free radicals. And what those free radicals do is they go into the tooth and they essentially break down the colored molecules within the tooth. And so when it breaks down those molecules, it allows light to penetrate and it makes them appear whiter. So it's really a chemical process that's happening within the tooth. So it's really interesting. You know, most people think like, oh, I can't whiten if I have braces because I'll have little white spots. But you actually can whiten when you have braces because the way that whitening works is it penetrates within the tooth and whitens from the inside out. So even if you have braces or, you know, different scenarios, you can always whiten. The only thing that will not whiten, like we talked about earlier, are going to be your fillings, your crowns, and your lab work.
Can I add on there? Sorry, Rick. When you have braces, you should bleach. Because what will happen is there's actually a benefit to bleaching is it keeps the bacteria and the plaque from adhering to the tooth. So you end up with actually cleaner teeth. So I had braces, and at one point my teeth got so yellow and it would drive me crazy. But it actually, not only will it make your teeth whiter, but it'll actually keep the plaque from adhering to the tooth. So in essence, it helps your gums, it helps everything.
So why do some people get like those little white spots on their teeth after they bleach?
So a tooth will dry. So a couple things. Whenever you dry out a tooth, whether you just put cotton in your mouth and let it dry out for an hour, or you put bleach, it will those decalcification spots. Basically, it's enamel that's been damaged, and those white spots. Once you bleach, those white spots will actually show up. But typically, those white spots go away within a day or two. Once your tooth rehydrates.
Yeah,
I have a couple of those spots that show up after I bleach, but they usually gone by the next day.
Yeah, so you'll notice it when you have dental work too. You know, when your mouth's open for a long time and after your dental work, your teeth will be really, really white. And that's because they're dehydrated. But as, you know, you go back to talking, your teeth will start to rehydrate. And so it'll get that color back.
So Liz, talk to me a little bit about, we've got Michael and his staff who are professional, know how to do this. And what are the difference between doing that and doing it yourself in terms of success rates and stuff like that? Because one thing I want to talk to you, my wife she has horribly sensitive gums and she cannot use the strips because it just, and her mouth is a flame. So when Michael does it, it doesn't do that because you don't get it on your gum. So,
Yeah, they will go over technique with you. They might recommend, a sensitivity toothpaste, or they might recommend a fluoride varnish. And so when you do it under supervision of your dental provider, they just have different tools under their belt that can help you, whether it's fluoride treatment, potassium nitrate treatment, sensitivity toothpaste that they might recommend, and then the technique as well with it. So they're going over how to use it. You're not trying to figure it out on your own. And so therefore you just have a little bit more support when you're doing it through your dentist. And then when we're talking about products too, we also have to think about, you kind of get what you pay for. And if you're purchasing your whitening products from the internet or from, a drugstore, you don't really know what you're getting. And so that's why I think it's really important to go through your dental provider when it comes to whitening, because you want to make sure that you are using something that is reputable. And so as the clinicians, that's what we're looking for. We are making sure that what we're recommending to our patients has a reputation, that it's evidence-based, and that there's actually studies to back it up. And so that's what we're bringing to the table when we are recommending something to you as your provider. You don't get that when you're just purchasing a product off the internet. And so, you might see a model who has great white teeth and you think that you might get those results, but the reality is you might not. But when you're going through a doctor, like Dr. Bratlin, you're going to have that product that has that research behind it and has those studies behind it. And so you're just going to get overall a better product.
So Rick, sorry, Rick, I was just going to tell you, for your wife, we can just do the 1 hour in-office bleaching. So what we do is we actually cover the gums, so no bleach will actually get on her gums.
Okay, so in terms of, like, if somebody has pretty yellow teeth from coffee, why don't you do this, Michael? What are the things that stain people's teeth the most?
Coffee.
Is
coffee,
it really?
teas, red wines, and I love my coffee. So,
it's my beer, but I love my coffee too. I drink a lot of coffee.
Yeah. So anything, even like they say chocolates, which I got to wonder about, but anything that is dark, but definitely wines, teas, coffee.
And we always say anything that will stain a white shirt.
Oh,
which
there
is
you go.
Pretty much everything when you really think about it. So I would always tell my patients too, we have to manage their expectations. And also it's like, as long as you're drinking coffee, eating berries, really putting anything in your mouth that has color, you're bringing that stain back into your teeth. And so like you said, Rick, it's something that you have to do continuously, if you want to maintain that white smile.
Jenny has a question. Jenny Ranch. I had some bonding work done and they didn't match the color correctly. So 2 of my teeth have yellow tint now. Is there anything that will work, or do I need to get them rebonded?
So I'll answer that. So it depends on how thick the bonding is. If it's a very thin layer of composite bond, and then you have a lot of tooth structure underneath, if you bleach, and especially like the trays, if you bleach it from the inside, I would start out by trying to bleach your teeth. Because sometimes it's a small little filling, but you can actually bleach around it, and the bleach will penetrate somewhat. So I've had some people that have a little bit on the front. I make sure they bleach on the inside too, and it does help. It just start out with the bleaching try bleaching it before you remove them.
Can whitening your teeth cover a dark line from damage done to the tooth?
Why do you cover a dark line from damage to? Depends on why that dark line is. Usually, I mean, if it's I would have to take it. I'd have to see a picture. And anybody can always, my phone number here, you can always text us. So if you have a question, it's easy. Just take a picture of it and text me, and Rick will give it to you.
So Kelly, I will get his phone number to you. In fact, I can put it on a list here. Michael, remind me when we get done here. And Kelly, so then Kelly, just take a picture, send it to Michael, and he's really good about helping you with stuff like that. Michael, here's another one for either one of you. Is it true that getting your teeth whitened helps prevent or slow down receding gums?
Go ahead.
I have never heard this. I don't think there are any studies that say this is true. Typically, you get recession from a lot of other things, and so bleaching won't necessarily take that away. So I would say I don't think it's true.
I was going to say no. I don't think it would reduce it, slow it down at all.
And Miles, I think we already talked about this, but you just tuned in, so we'll we'll answer this again. Can you regrow enamel, Michael, or once it's gone, it's gone?
Yeah, once it's gone, it's gone. That's why you got to be really careful what whitening material you use, because a lot of the older stuff and the stuff you buy on the internet is abrasive, and it'll wear it off.
So Kayla says a tooth whitening group tried to convince her that it would reduce her gums. That's why you go to a dentist, Kayla.
Yeah.
I mean, that's why I go to Michael. Yeah, so you go to somebody like that.
Yeah.
I want to ask a dentist, LOL. Yeah, well, that's why we got him here.
Yeah.
Now you can ask him.
And again, if you guys and Kayla, if you have another questions, just text us. And FYI, once you become a patient of mine, I give you my cell number. So those are questions that people will text me on the weekend. So you can always just text me personally.
No, he does. I mean, what kind of dentist does that? I'm looking up your number right now, Michael. I'm going to put it in there. But yeah, that's the funniest thing I think about you is what dentist have I ever known that gave me his phone number to text him on weekends?
Well, it's funny because a lot of times it's not really an emergency, and I'd hate for one of my patients to go to the ER because they couldn't get a hold of me. And so I get a lot of texts. I get a lot of texts from grandparents about grandchildren, but it's just easy. I mean, it takes me 2 seconds to look at my phone and get back to a person.
Okay, so I just put Michael's phone number in there, guys. Insurance, does it pay for whitening? Probably not.
No, typically not anything cosmetic.
How long does it last?
I would say that depends on the patient. Once again, it goes back to lifestyle. If they're, drinking wine every night, eating a lot of berries, chocolate, coffee especially. But I would say a few months. But whitening is definitely something that is lifelong. It's something that you will do, a few times a year if you want to maintain your white smile.
So what is the actual? Oh, go ahead, Michael. Anytime.
Well, I was going to say, I did read something recently that says that after you bleach your teeth, you should wait 48 hours. Because when you wipe your teeth, you're kind of opening up pores, kind of like when you take alcohol to your face, it opens up the pores. Same thing. You have these microscopic pores inside your enamel, and so they say that you're supposed to wait 48 hours. And there's a couple tricks that we can go over with you. After you do whiten your teeth, you should always put like toothpaste in your mouth for a little bit. It actually will clog those pores with calcium and phosphates, which actually help with the sensitivity and help you from getting restained.
So what is it actually? You said peroxide is the bleach. What's actually in the bleach? It is peroxide.
Mm-hmm. And there's a few different types that you'll see. I would say hydrogen peroxide and carbamide peroxide are the two most common that you will see in your bleaching products.
So when did this bleaching craze start? Because I remember doing it back in I was on the news anchor, so you got to be a pretty face, so you bleached your teeth. And I remember
Liz wasn't even born then. So, but even
actually, it's funny. Opalescence, which is our whitening, was born the same year I was. So we're both 30 years old this year.
Liz, remember, I can remove you from this conversation just with a click of a mouse.
So they actually, I remember when I was in dental school a long time ago, they said that the Egyptians used to try to whiten the teeth with urine, but I don't recommend it. But they said it also, there was a little bleaching in the early 1900s, but now it's pretty much the stuff that we do now, the stuff that's been studied now for over 30 years was in the 80s.
So what about the product called Snow? Have you heard of that?
So Snow it's a newer one. It's very popular on social media. So this is, again, one of those products that I was telling you about that people are often advertised to on Instagram, Facebook, that kind of thing. I don't know much about it, but as the patient, the things that I would look at are, the science behind it. Is it reputable? Is it something that has research and development behind it? Because once again, this is something that we're putting into our mouth, that we're exposing our tissues to. So those are some questions I would ask as the patient.
And so how much does it, so the kit costs $8. Is that how much? And that's for, what is it? What does that include? Kind of show me the stuff. I'm going to get this thing off of here so that I don't have a med. And let me just go like that. There, it's lower. So
the kit Dr. Bratland's talking about is this guy. So it's a box, and it comes with 10 upper and lower trays. So upper, lower. So you'll get 10 of these. And then you'll also get a little whitening toothpaste. This is a toothpaste that we use and we formulate, and so it is not overly abrasive, so you don't have to worry about that. It's very safe to use. And so essentially what they are is just pre-filled whitening trays. So you don't have to come in, and they don't have to take impressions of your teeth and then make models. It can be kind of cumbersome. And some patients don't like it because they don't like the material in their mouth. So this just allows that Dr. Brotland to offer a product that's not only effective, but that's really, really easy for you as the patient to use.
So real quick, sorry, I have both. I have custom trays, and I have those trays that I got a box of 10. I love those trays because once you're done with them, you spit them out and you're done. The trays that we make you, which are, nice, but after you're done, you got to rinse them out. You got to have them ready. And I keep a box in my office. And I also keep a box at home. And when I think about it, I just pop them in. They're great.
Yeah, they're really easy.
So the reason people do this, is there any kind of health reason to do this, or is it mostly mental health? And for me, I just think having a smile that reflects a brightness, I think it just is, it brings people into your fold a little bit. And I know some people think it's kind of surfacey, but I think it's one of those things. To me, it's like, drying my hair, combing my hair, making sure I want to put that right face out there so that people aren't, looking at my teeth and going, and it makes me feel, I'm already 61. I don't want my teeth to look like they're 70. And it's so simple to do, especially when I can just get a kit like that.
Yep. And like we said, we're in the smile industry. We're here to make you feel better about your smile and hope that will open doors for you and just bring out that confidence that maybe you didn't have. So we really feel like it just provides us with something that patients want. It's not because we feel that it's necessary. And sometimes it can be, like if Dr. Brotland said, if he's doing some cosmetic work and he's doing something, in the front of the mouth where, maybe the patient wants to go a little bit lighter, or maybe they had some dental work done 10 years ago and it's a little bit yellow and they would like something to look better. So it's just one of those products that can kind of open those doors for you.
I gotta tell you that I've had people that build up plaque really quickly, and I do recommend Bleach Teeth for those patients because they'll get a calculus bridge on the inside of their bottom of their teeth. And it does, like I said earlier, it does make your teeth smoother, and it's harder for the plaque to adhere to your teeth. So there is a benefit.
Is abaquinol, is that what you sell? Is that what we're talking about?
No.
So they say that says something to do with your gums. That's what Stacey's talking about. Jenny just hopped on. How do I buy a kit? Well, you can win a kit if you go on and you like the CrisDental Facebook page and just put your name on there, tell them what you're doing, and then they're going to pick a couple of winners. They're going to give away 2. Otherwise, you can go into CrisDental right over on Oakway.
Come into my office. I prefer, I'm supposed to do a new patient exam on you before I give you a kit because it is higher concentration of peroxide. And if you had an open sore in your mouth, it would hurt really bad. So I'd love to see you first, and then we can sell you a kit.
Yeah, typically whenever, as a company, we recommend whitening after your doctor has seen you, because we want to make sure that we're looking at, what's more urgent too. If you come in and you get an exam and, you have a bunch of cavities, we might want to pay attention to that first and then maybe start whitening for you. So that's kind of the perks of going through your dental professional, is that we're kind of looking at the big picture before we just focus on the cosmetics.
So I got a question. Do you get your teeth cleaned before you whiten them, or even if somebody's at home doing the home kit or taking that kit home, because I've heard both things. Put it in, don't brush your teeth first, or brush your teeth first and then put it in. Which is best?
Liz?
What do you recommend for your patients?
So I'm going to recommend, I pop my trays in, but at any time during the day, but I brush my teeth probably 10 times a day. Yes, you want to brush your teeth, you want to floss before it, because if you have something between your teeth, it's going to keep that bleach from kind of getting in there. And some people will have darker staining between their teeth. So yeah, brush and floss beforehand, and then put it in.
So Michael, this is totally unrelated to teeth whitening. Are you scared?
Who does my hair?
Yeah. How do I get your haircut? Yeah. No. what I was going to ask you, my friend, is as a dentist, what is the biggest thing you could say to people that they could do to really help themselves? Because you see everything coming through your office.
Yeah.
And what is the biggest thing you think people should do to take care of their teeth?
Well, besides brush and floss, which is obvious, and it's amazing how people don't floss. I got to tell you, floss is a big thing. But once you floss and once you brush, I actually do think bleaching is important, because the first thing I noticed with you, Rick, was your teeth, and they're good looking teeth. And so as a dentist, maybe it's just because I'm a dentist, but I look at people's teeth. So bleach is important, but start out. I mean, it doesn't matter the bleach if you don't floss and you don't brush, because you'll lose your teeth. But once you get your teeth settled and there's no disease, then absolutely bleach.
So Jenny, you know what you should do? Call the number. I put his number. In fact, here it is. Call the office.
First of all, that's my cell number.
Oh, don't call that number. We'll call the office.
Yeah, that one. Call
What's your office number? Do you have it?
Yeah, it's a 541-762-2747.
Okay, and I'll go take that other one off.
Yeah, and I don't mind if people text me and have dental questions in my personal. But if you want to make an appointment, call the other number. Yeah.
So Jennifer, call that number and then talk to them about an exam in order to get the kit, and then they can kind of deal with all that for you. Okay, does that work for you? I'll be sure to call the office. Yeah. There, Michael, your wife's going, how come you're getting all these texts out there,
Well, at midnight, yeah.
So Liz, thank you so much. That was awesome.
You're welcome. Thank you for having me.
Well, now I'm going to be able to tell my wife I actually know something, I mean, I can go in and kind of have a regular, because I think sometimes a lot of people like me have in the past have bought those little kits, and I don't really know what they're doing, and they do kind of hurt my gums sometimes. And I have had them professionally done once, which now I'll be coming into CrisDental and doing that. And it was completely different. I only did one day. It was like, I think that's the best thing about doing it with a dentist. It's done. I'm not sitting here going, putting, I like the trays. I hate those strips.
Yeah. Well, you know what?
And then you go, scrape them off. And then they're all, if you're driving, you should never throw them out the window, because they get stuck on your car, and then you find them later on your car. They're horrible. Anyway, that's my experience. It hasn't been good, so I don't do that anymore. Thanks, you guys. I really appreciate you coming on here and doing that. And again, you guys, if you're looking for any kind of dental work, Michael does everything. And he's got a great office, great staff, very COVID friendly in terms of killing COVID. I mean, the place is a sterilization factory. And we have a video online that's you can go on there and just look on my videos, and you'll find it, that shows a pretty extensive system of cleaning that place up. He even sprays himself with the spray stuff. All right, you guys, thank you again. We'll see you later. Have a good day. All right, you guys. And again,
thanks, Rick.
I'm going to pull you guys off here for a sec so I can say a couple more things. So you guys, if you want to win one of those kits, go to the CrisDental Eugene page, Facebook page, and just like it, and then let them know, say something on there that I'm entering the contest for the dental kit, and then you'll be in the eligible running for that. If you do have any other questions, like Michael said, he's really open and easy to talk with. Just a local man, went to school here and decided to be a dentist. He was a journalist before that, and then he went back to dental school. So he's smart. He got out of journalism and went to dental school. All right, you guys, I'm Rick Dancer. We will be back tonight, 8 o'clock, a little bit before 8, about 7:45. Any lab tests now, who happens to be Michael's brother, who owns that, Adam and Stephanie, we're going to be up in the Thurston neighborhood, where a neighbor has done some very interesting things to bring the neighborhood together. And I think you guys are really going to enjoy this. So that's tonight, 8 o'clock live in Mountain Gate up at Springfield with Any Lab Tests Now. And Any Lab Tests Now, in case you didn't know, they do over 8,000 different tests. You can take care of your own healthcare just by managing the lab tests that you do. All right, I'm Rick Dancer. This is Get Real with Rick Dancer. We will be back tonight.